Welcome to our educational presentation on interventional procedures for screening mammography. Before we begin, please note the following. This presentation is for educational purposes only. It is designed to enhance understanding of medical options available for managing cancer pain. The information provided should not be used as a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information, is the property of drsimplified.com and is protected by copyright laws. Reproduction, distribution, or transmission of any part of this presentation is strictly prohibited without prior written permission from drsimplified.com. Thank you for respecting our work and rights. Screening mammography.
Alright, Siraj, let's tackle the topic of breast cancer screening in a way everyone can grasp. Ready to make this interesting?
Exactly. Just like choosing the right security system, deciding on breast cancer screening is about knowing your neighborhood's risk and how much peace of mind you need. And always, keeping an eye on that treasure.
I like where this is going. But how do we decide when to start these checkups?
Well, it's like setting up a security camera. For most people, installing it around age 50 makes sense since that's when the risk of intruders, cancer, increases. But just like in any neighborhood, some areas, people, are at higher risk.
True, but what about those under 40?
They're living in a pretty safe area where the risk is low, so they don't usually need a camera. But from 40 to 49, it's like moving to a place where you might want to consider some extra security based on how safe you want to feel.
And after 75?
If you're healthy and expect to be around for 10 more years, keeping that camera running makes sense. But if not, maybe it's okay to turn it off and just enjoy the scenery.
How often should we check the footage?
Every 1 to 2 years is ideal. Too often, and you might get anxious over false alarms. But wait too long, and you might miss something important.
What about the added gadgets, like ultrasound or MRI?
They're like the extra sensors you might not need unless your house is in a high-risk area. For most people, they might cause more worry without really making the treasure safer.
I must say, I'm impressed. It's important everyone understands their own risk and discusses the best security plan with their healthcare provider, right?
Exactly. Just like choosing the right security system, deciding on breast cancer screening is about knowing your neighborhood's risk and how much peace of mind you need. And always, keeping an eye on that treasure.
That's all for today. See you in the next video. Thank you for watching. Thank you for participating in our educational session. We hope you found the information valuable and enlightening. Reminder: this presentation is the property of drsimplified.com. Any use of the content, including copying or distributing without explicit permission, is strictly prohibited. For further information or to request permission for use, please contact us at contact@drsimplified.com. Stay informed and take care.